Hi, welcome to my channel, A2Z, Flee from this disease. My name is Ronaldo Poole. I am a medical student, and today we're going to start with the first letter in the alphabet, letter A. Aortic aneurysm. In this lecture, you're going to learn all you need to know about this disease, and at the end, we're going to practice some flash quiz from the USMLE Step 1. Let's go ahead now and define what is aortic aneurysm. So it's an abnormal widening or bulging of a part of an artery due to weakness in the wall of the blood vessel. Sorry guys, my drawing is not the best, but I hope it's helpful. Here we have aortic septum, the heart, thoracic aorta, artery to the kidneys, and abdominal aorta. Basically, there's two types of aortic aneurysm. We have the thoracic one and the abdominal one, the most common one. Now we're going to understand the pathogenesis behind the AAA, aortic abdominal aneurysm. Due to the absence of vasa vasorum below the renal artery in the abdominal aorta, that area will not receive sufficient irrigation. The vessel wall integrity will be compromised, leading to the weakening of vessel wall. And then, according to the law of Laplace, the increase in vessel wall stress will increase the vessel diameter. So that's when the aneurysm will appear, and now we're going to see some risk factors for that. The first risk factor is smoking. So if you're a smoker, you have a higher risk. Being a male, family history like a connective tissue defects, then we have atherosclerosis, hypertension or high blood pressure is the same thing, diabetes, hyperlipidemia, and age. Usually in men above 65 and women it presents in latest age, like 10 years later than in men. So here we have the 8 main factors to develop the aortic abdominal aneurysm. Regarding the morphology, there's 2 types, the saccular and the fusiform one. Now that we have understood the pathogenesis of this disease, AAA, let's go ahead and see the clinical presentation. Usually they are asymptomatic. When they do present symptoms, they are due to a complication like a rupture, and the patient presents with the abdominal pain that irradiates to the back, similar to the pancreatitis. The only thing is in pancreatitis, the patient has a history of alcohol abuse or the gallstone. And usually the AAA presents in a male above 65 years old with the risk factors already discussed. On the clinical findings, as we already know, it's usually asymptomatic, but during the physical examination, we can find on inspection a pulsatile abdominal mass with risk of rupture. That's why we don't do palpation in these cases. Auscultation, we will find a bruit, harsh sound, and we can possibly find a blue toe syndrome as well due to embolism of the atherosclerotic plaque. Most common complication of the AAA, aortic abdominal aneurysm, is the rupture. And there is a rupture triad, which is sudden onset of severe flank pain due to the bleeding in the retroperitoneal compartment, hypotension, pulsatile abdominal mass. The greatest predictor of rupture is the diameter of aneurysm. The treatment of this disease depends on how big it is. For the small and medium ones, usually the risk of rupture is less, so we usually advise the patient to monitor and do the lifestyle changing. And for the small ones, monitor every year, and the medium one every 3 months. If we see anything concerning, surgery might be considered. And the large one usually has more chance of rupture, so surgery is recommended at this point. And there's 2 types of surgery, the endovascular surgery and the open one. Now let's go ahead and take a look on the second type of the aortic aneurysm, the thoracic one. This one is less common than the abdominal one, and the reason why is because it presents the vasa vasorum in the adventitia of his walls. So as we can see in this image, the vasa vasorum is absent below the renal artery, in abdominal aorta, which is different in the thoracic one. So the question is, what are the causes for TAA, thoracic aortic aneurysm, knowing that it has its vasovasorum? So the first one is the hypertension, then we have the connective tissue disease, the bicuspid aortic valve, and then we have associated with Marfan and Ehlers-Danlos syndrome, and then we have the syphilis in third stage and traumatic aortic rupture. An example of this is a rupture deceleration injury. Now, the reason why tertiary syphilis produces the thoracic aneurysm is because at this stage of the disease, Treponema pallidum blocks the vasovasorum, decreasing the irrigation, leading to an immune response which attacks and damages the vasovasorum, producing the obliterative endarteritis. As I promised before, now we're going to do flash quizzes of everything we learned about this disease. Are you ready? Let's get started. Time! And that will be all for now. Stay tuned for our next video. Aortic aneurysm prevention. See you!